Dr. Gupta, after a day like this, when Donald Trump creates this public health mess in the briefing room, I just want to give you an open forum to choose the number one thing you would like to correct from what Donald Trump had to say today.
Good evening, Lawrence, and thank you for that opportunity. The number one thing is that large portions of this country are not corona-free. I thought that was a deeply irresponsible comment from our commander-in-chief. 21 states are in so-called red zones. For your viewers out there, please go to covidactnow.org. It's the one source of truth that I know my colleagues and I in public health rely upon. What you'll see is that 1 in 5 individuals in Arizona test positive. 90% of ICU beds in Florida, the data that we do have, because they've been manipulating that data, 90% of ICU beds are full. In Texas, 100%. This is not going away. What about school teachers and school districts struggling with reopening? The president's not taking this seriously. People want point of care devices so they can test their children. Teachers can test themselves and their own family. So that type of messaging belittles the challenges that people are facing to renormalize life and to do so safely, Lawrence.
What would you say about the president tweeting, as he did, a video that says that there is a cure for coronavirus?
Oh, it was stunning. It was stunning in the extent of disinformation. I'm glad to see that big tech is policing him and taking it down, and taking down the videos of the physician, Dr. Emanuela in Houston, who is peddling this nonsense. It's ridiculous for her to peddle it in the first place, and then for the president to retweet comments like masks do no good. Masks are the only thing. It's our first line of defense, and in the absence of a vaccine or a therapeutic, it's our only line of defense right now if we actually want to renormalize parts of life. It's the only thing, and it absolutely does save lives. So that's deeply irresponsible, and you wonder, does he have the interests of the nation at his heart if he's retweeting things like that? Hydroxychloroquine, how many times do we have to navigate this debate? Let me be clear, Lords. In inpatient studies, any individual who has COVID-19, who has received this drug in a study that's been hospitalized, this drug has been proven to be harmful. Dr. Fauci has said that. Dr. Birx has said that. Actually, people have more adverse effects, heart arrhythmias, if they're admitted and receive this drug than if they don't receive the drug. There's no mortality benefit. People should not be taking it. There's a reason why his own FDA, the president's FDA, has said, no, we're not going to use this for COVID-related uses. So deeply irresponsible on a host of levels.
I've taken malaria drugs like hydroxychloroquine for a 2-week period. Donald Trump said that he took them for a 2-week period, but I did it only when I was entering and leaving a malaria zone. He said that his taking it for 2 weeks proves that it's okay.
I think he's trying to save face, Lawrence. He's not trying to save patients. And to your point, chloroquine, hydroxychloroquine, they have certain use cases that are tried and tested, that have been rigorously analyzed. In this case, it's not. There's a reason why we say do not take hydroxychloroquine for COVID-related indications.